How do you know if you have osteoarthritis or rheumatoid arthritis? In this video, I'm going to tell you exactly how to know. My name is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you some realistic advice based on my experience. A lot of people come in with osteoarthritis. Now, I live in an area that's kind of a retired area. People are retired, they're older, and when you're older, quite frankly, you're going to get osteoarthritis. Osteoarthritis typically happens in singular joints. So in other words, osteoarthritis may happen in one knee or one shoulder or your hands. People get arthritis in their hands. Their hip. So in other words, you may have one hip that's totally normal and another hip that has tremendous amounts of arthritis, probably because of an old injury. Typically, osteoarthritis requires some type of strain on the joint. And if you can imagine, if this is my hip joint and here's a socket, on the surface of both sides of the joint, there's what's called cartilage. And this cartilage is very similar to it almost is like a Tupperware type of feel, a wet Tupperware, so that both ends of the cartilage can actually rotate without a lot of friction. Well, when the cartilage wears out, that's called osteoarthritis. And very often you'll see it in people, their knuckles will grow, they'll get it in their hands, they'll get it in their hips, they'll get it in their knees, and they'll get it in their spine. Those are the most common places where people get osteoarthritis. If you're over the age of 40, you're developing osteoarthritis right now. There's no way of not doing it. It's just a matter of how bad does it get. When the osteoarthritis gets severe, very often you need joint replacement. This is very often seen on an X-ray or an MRI, or quite frankly, you can examine the patient and you almost don't even need an X-ray for it. It's nice to have an X-ray, of course. X-rays are visual, people are visual, they like to see their X-ray, and generally patients won't believe you if you tell them they have osteoarthritis unless you have an X-ray. It's kind of funny because sometimes you'll have a patient that comes in and they're 76, 84 years old and their hip is bothering them, and you do an exam and clearly it's osteoarthritis, and you tell them you have osteoarthritis and they go, "What? How is that possible?" Well, you're 84 years old. And the exam shows it, but generally speaking, if you go to a doctor and they take an X-ray, you'll see osteoarthritis on an X-ray. Rheumatoid arthritis, now you can see rheumatoid arthritis on an X-ray, but if you see rheumatoid arthritis on an X-ray, and that's your method of diagnosis, you're lost. You're just lost. Rheumatoid arthritis is actually found in the blood. So if you have a blood test, you'll find out that you have rheumatoid arthritis. Rheumatoid arthritis is totally different. It's totally different than osteoarthritis. Typically, rheumatoid arthritis will attack the joints. It's a kind of a condition, an autoimmune condition, an autoinflammatory condition that attacks your own body's joints lining. So in other words, remember when I said there's a hip socket and a joint here? Well, it's not the actual cartilage right here that gets destroyed. It's the soft tissue around the joint that holds everything together, called the capsule. Very often it'll get super inflamed, and with inflammation becomes scar tissue, and then the joint just gets destroyed. The joint will not get destroyed just in areas where there's weight bearing, but it'll get destroyed in other areas where you would never think of getting destroyed. So people, their wrists, different joints of their hands will deviate and contract in weird ways. But the key to rheumatoid arthritis is that it's an autoimmune disease that attacks the joints and the joint linings symmetrically. So in other words, both knees will hurt, both ankles will hurt, both hands will hurt in a very similar way. And that's really how, just on YouTube, without having a blood test and without having X-rays and everything and without seeing a doctor, if you're getting swelling, heat, destruction of the joint symmetrically on both sides equally, or pretty much equally, it's more likely it's rheumatoid arthritis. Sometimes it can run in families, sometimes it's so random. Typically, more often, it's more often in females than males, but that doesn't mean males don't get it. So that's how you tell the difference in a nutshell of the difference between osteoarthritis and rheumatoid arthritis. If you yourself have either of these, let us know in the comment section and let me know what seems to help you. It may help others. I have found in my practice that I see a lot of patients that have both, and we've come up with protocols that help both for both these conditions. But if you thought this was an interesting video, give me a thumbs up, subscribe to the channel. If you have any questions, ask in the comment section below. Share this on social media. Put it on Instagram, Twitter, Facebook, that type of thing. It may help someone. And lastly, I do have a Patreon account. There's a link down below. If you become a patron, I greatly appreciate it because it helps support this channel. If you have a question, I'll answer your question in video form just for you.